Okay. Before we start the agenda, before we go into the first presentation, I would like to say something here. Could you, sir, place a picture on the screen that we have? I want you to see this young lady who is our health director sitting on the floor at the Crown Coliseum, working to make sure that every 300 to 500 people on that particular day, 500, correct? 500 individuals receive their vaccination. And she was running around there like somebody on skates, like Sally normally does, running around with skates on. And she was working very hard, as well as the public health department staff, the emergency services and emergency management, the sheriff's office, the Crown Complex, the public information office, the Cumberland County EMS, the print shop, and our volunteers from Fayetteville Tech, Community College, Fayetteville State University, Civil Air Patrol, Community Emergency Response Team, and Team Rubicon. All those made it happen, or it's making it happen. I had the opportunity to go out and visit, and everything was right in place as far as I know. And everything was running very well. And the people that I had the chance to talk to that was in line, they were very pleased about what was taking place that day. So I want to thank you to everyone that I just mentioned for doing a job well done. And I thought my colleagues should know about it. And I would like to encourage each one of you, if you get the opportunity, to please go out and see all this take place. Thank you.
She's like that all the time. All the time. Wherever she is, she's everywhere.
Yes, ma'am. Thank you. Madam, go ahead.
The first item on the agenda is the approval of the agenda. So moved.
Second.
Second.
All in favor?
I need to call the vote.
It's not virtual though. I mean, it wasn't, was the advertising virtual?
Yes.
Oh, okay.
Everybody in favor, Commissioner Layton? Ms. Out loud.
Yes, ma'am. In favor.
Commissioner Thompson? Commissioner Heath?
Aye.
Chairman Evans?
Aye.
Commissioner Adams?
Aye.
Commissioner Steve?
Madam Manager, are there any changes to the agenda?
Yes, sir.
Thank you.
That brings us to the approval of the minutes from the December 10, 2020 agenda session regular meeting.
Do I get a motion?
Second.
All in favor? Or raise your hand, please.
Just gotta call you out.
Commissioner Lancaster, your vote?
Thank
Commissioner Council?
Yes.
Commissioner Heath? Chairman Evans?
you. Aye.
Commissioner Adams?
Yes.
Commissioner Stewart? Thank you.
Mr. Chairman, that leads us into item number 3. We have a presentation today. We have asked Dr. Green to give a very thorough summary today of the COVID-19 vaccination planning process. As with anything else, it's never as simple as it seems. Dr. Green is working with the other 99 health directors under the umbrella of the Department of Health and Human Services. And so Dr. Green, you come forward and share some very important information about our vaccination clinics and your planning.
Good afternoon, Commissioners. Thank you for that. Picture of me, sitting on the floor. I think I'm on a conference call with the school district, sitting on the floor there. So thank you for the opportunity to share an update about our mass vaccination plan and our update. I want to acknowledge Dean Duke. He is in the room with me today to help answer any questions that you may have. We've been closely planning with emergency management over the last several months as we prepared for our mass vaccination. And forgive my tennis shoes. I usually don't wear tennis shoes, but I was at the clinic this morning, so we have our running shoes on every day. So in terms of organizational structure, we have implemented the use of the FEMA Incident Command System, ICS. So we use ICS structure each day when we are on site. This allows for common language between emergency management and the health department, but also between our volunteers and our staff and others that may be in the room. So all of our staff, as part of their normal orientation, do ICS training, and so this is an opportunity to implement it. It also allows us to manage by objectives and those key objectives each day. We sort of put our normal chain of command out of the window when we have ICS structure in place, and we have a different structure in place, and you're not normally reporting to you're not reporting to your normal supervisor. We have two incident commanders. Dean Booth and myself serve as the incident commanders. You're going to see there's an expanded version of our ICS structure, but we don't have it on the slide today because it's a pretty massive document, but you will see a shortened version of it later in the presentation. In addition, our emergency management personnel complete an incident action plan for us each day for each point of dispensing site. So that gets reviewed by myself and Dean and then signed off on. So we began provider enrollment for North Carolina's COVID-19 vaccination back in December. And this provider enrollment is a process for arranging and placing vaccine providers into the statewide system. We call it CDMS, the COVID Vaccine Management System, so that we can receive our vaccine and then administer vaccine as well. Initially, they only enrolled, the state health department only enrolled hospitals and local health departments only. In late December, they began enrolling FQHCs, federally qualified health centers. So Goshen has, I learned on last Friday that Goshen has enrolled as a provider, and then I was in conversation yesterday with them and Wade so that they can get enrolled as a provider as well. Other provider enrollment, our primary care providers, began enrollment yesterday, and so they will be able to receive vaccine, not currently, but as supply increases, they will be able to, FQHCs and other providers will be able to receive vaccines down the line. But currently, near the hospital and the local health department are the only ones that are can receive vaccine. So we made sure that all of our other local providers have this information. We use the BlastAct system, so we BlastAct that to them yesterday. So there's a few items in our provider enrollment agreement that we signed, and I'll just review a few of those things. So we must administer a vaccine in accordance with the prioritization that's laid out by the public health authorities. So those at the CDC and the advisory committees, and then also our state health department have to follow the priorities. In addition, that provider agreement is signed by myself and our medical director, Dr. Lori Hager. So the local health departments and hospitals and anybody in the future that enrolls our future providers, we each have a separate provider agreement. So that provider agreement means that we cannot, we have received the vaccine under our own provider agreement. We can't share vaccine across providers. So for example, if we did a co-located clinic with the hospital, they have their cooler of vaccine and I have my cooler of vaccine, and we can be in the same space administering, but I can't borrow from their vaccine, their cooler, and they can't borrow from mine. We can be inventory and administer from our own supply. We can transfer vaccine if we have a formal agreement in place and approval from the state health department each time it's time for enrollment, each time we want to enroll. We also operate under standing orders as we do with any other clinical service. So we have similar standing orders across the state, but each person's standing order is a little bit different. So all of our vaccinators need to operate under our own standing orders. And those are signed off by our medical director, Dr. Hayward. And then we also must vaccinate regardless of residency. So I think this came out on the news yesterday that people, we need to and required to vaccinate anybody regardless of county residence. This morning we had somebody from Tennessee come to the line, and we vaccinated individuals from South Carolina as well. So we are required to do that. And then we also have to follow the storage requirements for those that are for both types of vaccine that we receive. So there are other vaccination partners that receive vaccines for Cumberland County. That includes Fort Bragg Department of Health. So all of the information that is on the State Health Department website does not necessarily reflect Fort Bragg's numbers, because those, even though those citizens, they live in Cumberland County, Fort Bragg has a different reporting. And the same thing is true, the VA also has their own supply of doses. And then in a previous commission meeting, we mentioned the partnership between CVS and Walgreens. So there's a federal, state partnership, private partnership with CVS and Walgreens, and their aim is to vaccinate the long-term care facilities and our skilled nursing facilities. We, at the health department, are vaccinating those members of the long-term care facilities and skilled nursing facilities that did not enroll in that federal partnership. So there was a deadline for facilities to do that back in December. If they miss that deadline, then we are, our role is to help them get vaccinated. So there's probably 80 facilities in Cumberland that did not enroll in that partnership. Most of them are small group homes, 5, 6, 7 beds, but there's a large number of them. And so we work with them to bring them to our vaccination sites so that we can get them vaccinated. And then we'll also go out and vaccinate other facilities as we move along. In addition, so the total numbers that we have for vaccinations are reflective of many different things, but all of them are not highlighted necessarily on the State Health Department. So in terms of our vaccine supply, the State Health Department allocates on a weekly basis, typically on Thursdays, sometimes on Fridays. We get a spreadsheet with information about how many doses that we're getting for the following week. So for example, today is Tuesday. I don't yet know what we're getting for next week. And then in addition, they are holding our second dose at the manufacturer. So when you get our allocations, they will tell us this is the first dose allocation or a second dose allocation. Because we received Moderna first, we don't have any second dose allocation that we've received yet. I anticipate that we'll get that next week when we move into our second doses for Moderna. But however, that doesn't mean we can't give somebody their second dose. It just comes out of a different allocation. So we are allocated vaccines to the health department. We cannot order vaccines from other locations. So I can't request to the state that they give us more vaccine. We can, again, we can get that number of how many doses we're getting, but we cannot request additional doses unless we partner with another agency to transfer them. Most hospitals are getting Pfizer. Local health departments, especially large local health departments like ours, are getting both Pfizer and Moderna, which of course creates a challenge because we have two different types of vaccines, two different sorts of capacities and expertise. So the number that we get each week varies. We've gotten anywhere from 975 doses to 2,000 doses, somewhere in there, but it varies each week. And the state health department has a formula that they use that's based on your storage capacity that we have submitted with our provider agreement. And then in addition to that, it is based on our population size, our county level, many different factors that they set that formula. So we are using a system called the COVID Vaccine Management System, we call it CVMS. We utilize this system to register individuals, to administer doses, to inventory and receive and ship vaccines, and do all things COVID vaccines in this system. There's currently not an opportunity to make future appointments in CVMS. They anticipate that will be available at a later date, but that is currently not a capability that is in the system. Individuals cannot currently self-pre-register for a vaccine. So I can't send out a link and people pre-register for vaccine. So we, at the health department or hospital, have to initiate the process for somebody to pre-register. So what that means is we collect spreadsheets from agencies and we can bulk upload those spreadsheets into CDMS. We need a name and an email address to do that. So in our initial rollout in our planning for phase 1A agencies, we reached out to them and we reached out to our local providers, our long-term care facilities, our funeral homes, more than 200 agencies to collect spreadsheets from them, and then manually went in and bulk uploaded them. And that process initiates the individual to register for themselves. But that process has to start with either the hospital or the local health department right now as we're the only enrolled provider. All of our users in the system, our CDMS system, have to have an NCID number, and then we have to enroll them to get access and permission from the state to enroll them as a provider. So we use the system in real time. So if you have an active vaccine site, you'll see our staff with iPads and laptops, and we enter in real time into the system, and we have paper backup available for those that have any challenges with CDMS. And many thanks to Gene and his team and to IT, because they helped us to secure laptops very quickly and iPads so that our staff would be up and mobile and that we wouldn't be on paper. So we wouldn't have to go back and backtrack and document later. So in terms of staffing, I mentioned we use ICS structure. So in addition to our senior leadership team being on site and emergency management being on site, we have a pod manager that is assigned each day. Dean's team and the sheriff's department are our safety officers. We also have the fire marshal out there to help us with site safety. And then we divide our staff into teams. So we have a support team, which includes our folks that are doing staff check-in and check-out, our traffic control folks, and those that are sort of our runners, you're the catch-all, we need you to help do something. We have our vaccinator team lead, who was our immunization coordinator, and our immunization coordinator backup. And we have a team of vaccinators. And then we have a team of people that are doing registration, and that includes interpreters as well. So some of these public interpretation, we have that available on site. So this is a massive effort. During phase 1A, when we were doing our closed points of dispensing, we had 40 to 50 individuals on site every day. And then during phase 1B, we have closer to 75 individuals. We probably have more than that today out at the vaccination site, making sure things are ready to move. So those agencies include, of course, emergency management, the health department, PIO staff is on site with us. Keith, Todd, very graciously have somebody out there from IT to assist us. We also have partnership from the nursing schools, and I'll talk a little bit more about that in a moment. The sheriff's office, and CERT volunteers, and of course, town complex staff as well. In terms of volunteers, we have help and assistance from Fayetteville Tech Community College and Fayetteville State nursing students. So they assign nursing students and faculty to assist us each day. Fayetteville FTCC was on site our first day during our first phase 1A closed pod on December the 28th. FSU, their first day was today, and so they're out there vaccinating. So each day they bring a faculty member and then students. We work with the students. The students cannot work independently, so we can't have them staff a station by themselves because they're students. So we typically partner them up with one of our staff members, or we partner them up with their own nursing faculty. Today, for example, we had 11 students from FSU and 11 students from FTCC and 2 nursing faculty and Fayetteville State as well. So when I left, they were launching their own station, but they need to be on site with us so we can oversee. We have submitted a web DOC request last week for additional assistance from the National Guard, and then we also submitted a web DOC request to the state for assistance from state health department staff. They informed us a week ago that we could request assistance. And again, grateful to Steve and his team because the data that requested the same day that it was rolled out. Today, we have also, as Chairman Evans mentioned, additional volunteers from Team Rubicon, Civic Air Patrol, and the CERT team on site with us as well. We have been exploring opportunities for collaboration with EMS. We have sought guidance from the State Health Department and the Board of Nursing. We cannot operate a site with EMS without our CHD or our health department staff with them. So we got clarification on that and also reviewed this with our medical liability insurance provider. They cannot operate a site independent of us because they are not operating under our standing order. And we have to be with them because their scope of practice does not extend to the same as a nurse. And again, they're not included in our provider agreement that we have with the state for vaccines. And again, they don't operate under our standing order. So there are some challenges with having EMS on site to assist that we're trying to, in terms of insurance and standing order, make sure that we have, make sure we are in that safety. So again, all of our volunteers, they must comply, especially those that are vaccinated, must comply with our standing orders and our medical liability insurance. Our medical liability insurance includes our nursing students and their faculty members, but it does not currently cover our emergency management or EMC. And then in addition, we're working with CIO to launch a volunteer list. So we are still running a health department in the background. We're still in the middle of the pandemic. So we're still doing contact tracing and case investigations. And we have more than 30 staff working on that on a daily basis. And that includes our own staff, but also individuals from the Carolina Tracing Collaborative, the NC, our hired temp staff to assist, and then also volunteers that wanted to help with contact. And then we also are required to continue our mandated services. So we have tried to prioritize our services so that we can continue to do contact tracing and case investigation, as well as continue and ramp up our vaccine efforts. So we, as per instructions from the state, we are prioritizing our STD visits, our TB visits, any communicable disease visits, immunization, school health assessments. School health assessments are already due to the school district, and now we're in the phase where students are going to get removed from school for not completing those assessments. And so we, even though the deadline is passed, we want to prioritize getting those students in. Critical prenatal visits for high-risk individuals, as well as services for child health. So that is mostly all of our services. So the State Health Department has rolled out a plan for vaccinations. They've divided this out into phases. This has been updated over time. This is very different than the plan we initially received back in October, November that the State Health Department submitted. The CDC, once the first vaccines were approved, after they were approved, they shifted who they wanted to get vaccinated in what order. So that meant the State Health Department shifted their plan, and then we shifted our plan right behind them. So we made changes to this. So the phase 1A remained the same. We focused on healthcare workers and long-term care facilities. But phase 1B is really where we saw the shift. They identified different groups to be vaccinated, and they get vaccinated in this order under phase 1B. Those that are over the age of 75, those that are healthcare workers and frontline essential workers over the age of 50, and then healthcare workers and essential workers under the age of any age. And that the CDC has a very clear definition of what that is. And again, we're required to follow the phase. And then phase 2 will be anybody that is 65 and older, regardless of your health status. And then after that is group 2, or phase 2, group 2, which includes anyone with underlying conditions. And then finally, those that are incarcerated or other essential workers that might be, that have not yet been vaccinated. And then in phase 3, we'll get to our students and our college students as well. So this is the timeline, and this is based on the State Health Department's plan that they gave to us. So after phase 1A,
The state health department put out some guidelines and said, January 6th will open to phase 1B, group 1, begin as our 75-year-olds, and continue 1A. They anticipated that most providers would not move to phase 1B, group 1 until January 11th. We moved, as you'll see in a moment, on January the 8th. We moved ahead so that we make sure that we were working in collaboration and tandem with our hospital. On January the 20th, no sooner than that, will we move to phase 1B, group 2. So this is the estimated timeline from the state health department. And then, in addition, phase 1B, group 3, no sooner than February the 8th, opening to that group and then all previous phases as well. So this is going to be based on federal supply and then local supply as well. So we have worked hard to make sure that we have some communication. PIO worked with our team to develop a website where people can find out when and where to go get vaccinated. That information at the top of the page. We have the current phase that we're in, and then instructions about how to get vaccinated, where to get vaccinated, including a map, and then what to expect when you arrive, so that everybody has the instructions for what to do when they get on site. We have a dedicated phone line and email address for vaccine updates. And then we have done, in collaboration with PIO, a number of radio and TV interviews over the last several weeks with ABC 11, WRL, WFMC, a long list of interviews, in addition to our standing interviews that we have already in the community. We've also done delivered community presentations for those that were in phase 1B and phase 1A, and I'll talk about those in just a moment. And then we also completed social media updates and presented several press releases. We made sure to coordinate with the hospital so that our information about our vaccine clinics appear on both of our websites. So you'll see, for example, on the state health on the hospital's website, we have some instructions for individuals if they'd like to come to the health department and vice versa. In addition, the state health department has launched the You Have a Spot, Take Your Shot website. That website has information by county where each person can go get vaccinated. So you can go on there and search by county and then get information about where to get vaccinated. All information is on that website for Cumberland County. We do a check-in with Taker Valley staff at least several times a day to make sure that we are where they are, and they are storing our vaccine for us, our Pfizer vaccine for us, so that if we need to get additional Pfizer vaccine out of our supply, because they're operating under our provider agreement, under our supply, that we are able to communicate about what we need. We are storing our own Moderna. So for phase 1A, as I mentioned, we collected and bulk uploaded hundreds of spreadsheets of agencies. We pre-registered more than 200 agencies and departments, including funeral homes, EMS, fire, and we pre-registered these agencies. We pre-registered more individuals than we have vaccines. We received our first dose of the vaccine on the 22nd, and we started vaccinating health department staff the next day on December 23rd. We held closed points of dispensing sites at the Crown for phase 1A on December the 29th, 30th, 31st, and during 5th and 6th. Most of these individuals are pre-registered because we've done the work in advance to upload them and get them registered. So that really helped us be able to vaccinate them. And then we also, when the hospital shifted into phase 1B, we also assisted with their overflow. So folks that weren't able to get vaccinated at the hospital were able to come to our vaccine site. So phase 1B group 1, we initially planned for that launch actually today, but we moved early so we made sure that we could work in alignment with the hospital, and we started that process on January 8th. We have an increased number of staff today than we did yesterday or last Friday. So we have additional vaccinators on site as we're scaling up our staffing. So we are vaccinating on Tuesdays, Wednesdays, and Fridays, and then we will begin some Saturday clinics on January the 23rd. So this allows us to make adjustments and tweaks. We always have a debrief after our pod
so that we can tweak and make adjustments for the next pod. So as we get ready for phase 1B, 2 and 3, we have held several meetings with essential employers that are in the space. So that was the picture that you saw of me sitting on the floor at the Crown. I was doing a meeting with the school district and our private schools to get them aware of what's coming next for them so that we can get their spreadsheets and we can start uploading those. So we started receiving those over the weekend. We also did meetings with the first responders, those in public transit, including FAST and the airport. Our daycares, our 200 plus daycares in the community, we're collecting those spreadsheets. We collaborated with Lisa Childers and K-State or from Research and Extension to make sure that we get those spreadsheets from the farmers and register them. And then during those meetings, we did a review of who of their staff are in phase 1B, and then when, how, and where to pre-register. And then yesterday, I did a meeting with the Cumberland Crisis Collaborative so we can get our behavioral health providers that are going to be in phase 1B, 2, and 3 registered. So Alliance and some of those agencies as well. So this is what the site plan looks like at the Crown. We are currently operating on a first-come, first basis, and we're following the phases. So we have registration outside, and this is shifted a little bit over time, and it's a little bit dependent on, how hard it's raining. We were out there in the rain this morning, but yeah. So we have registration outside. You arrive where the green arrows are, and emergency is traffic control help to put those individuals in line. Our staff go out to your car and register you on our iPad, and then we bring you into the Crown Complex, into this area with the white building, where we have a drive-through set up, and we have stations inside set up so that we can vaccinate each person in turn. Then they exit where the yellow arrows are, and there's a waiting area for individuals that we recommend that we observe you for 15 minutes after you've been vaccinated. And this is an area where we can observe you, and that parking lot is observed by an EMT. And we also give individuals instructions about how to alert us if they need to see. On the front building, we have a walk-in area for people that have 5 or more people in their vehicle or have a very large vehicle. For example, our group homes, especially in phase 1A, brought very large vehicles and we need to be able to accommodate. So that space is available on the front side. So a little bit about our site selection and the drive-through option. This allows us to maintain social distancing. So for example, we had 600 people in line, I think before 9 a.m. this morning. And if we try to get all of those people in a particular place or location, like the health department, we would quickly go over our fire capacity. So this helps us to allow us for social distancing and avoid potential super spreader events. It also avoids us having lines going outdoors. And so we heard lots of feedback from around the state and around the country that lines were, wrapping around buildings and people are waiting outside. The timing of this is just such that we are vaccinating in the wintertime. If we were in spring or in the fall, we might be doing something different, but we want to avoid people waiting outside to the extent that we're able to. And then this also, because it's an indoor-outdoor drive-through, it allows us to operate in very weather conditions. So even last Friday, it was pretty chilly outside and cold. We bundled our staff up, and we were still able to maintain services. If we did not have that indoor piece, what we would see when we did testing is that those tents might fly away, or if the wind got high. But this allows us to really continue operation. And this also allows us to adjust based on the supply that we have. So one of the challenges with appointments is that you have a set number of doses a day, and then if you have missed appointments, then that can potentially waste the supply. And so what that means is we vaccinate people, we draw a vaccine, we vaccinate at room temperature. We bring it either from the refrigerator or the freezer, depending on the vaccine. We bring it to room temperature, and then we vaccinate. The vaccine is only good for 6 hours. So if you have an appointment and you miss it, and you pulled your dose out of room temperature for you, and you don't have anybody to fill your spot, you have to throw that away at the end of the day. So this helps us to avoid wasting dosage due to missed appointments. And it limits to all calls. So what we've seen at other health departments across the country is that people have all calls at the end of the day because 10% missed appointments. And now I have 10 doses I have to have at the end of the day, or I'm going to throw them away. So this helps us to avoid sort of that all calls. And then we also are working to make accommodations for those long lines. And the crown is on the back restaurant, so that is helpful as well. We are exploring options right now to make some appointment options available. We know that the lines are long, and so we're trying to explore how we can effectively do that. We'll have more information to speak about how we're going to do that. So this is a picture of what it looks like. This is inside the crown. So on either side of inside of the building, we have 2 lines of vaccinators, both sides of the crown, vaccinating. We bring the cars into the building. Each station has vaccinators. They've already registered because they were registered outside. And then there is a center lane, and you can pull people in and out so that you're not stuck behind the car behind you. You can pull in and out of the lane as you're done, so we can come around to your car, vaccinate 2 people, 3 people, 4 people, however many people that are in your vehicle. And then you drive them out that open door at the other side of the building for the lady. So that's a lot of information all at once. I'm going to pause there and take questions that you have.
Are there any questions for Dr. Green? Yes, Mr. Key.
Thank you, Dr. Green. It's monumental. It really is, and I know sometimes you probably feel like you're making it up as you go, but everybody's trying to get together and do it the same way. When the providers, apparently today, they can start, or yesterday, they can start asking, does that mean the private provider?
Correct.
Okay. So will private providers not be, when's the earliest they'll receive the vaccine, and will they allow them to, my hope is that they get through 1A, 2A and 2B first, and then they start getting the providers to get it. But when do you see providers being able to have access to the vaccine?
That's a good question, and I don't know the answer to that yet. What we've heard from the state health department is that it's going to depend on the supply that they receive from the federal government. So we don't get to dictate that at the local level. So the vaccines come depending on the brand, and I'm going to call them packs. Each county or each provider only receives a certain number of packs. So if we get a pack of 975, that comes to the health department. I think that the challenge is if they try to chop that pack up, each provider would only get, you get 20 vaccines, you get 20, you get 20, and that would be sound. So I don't know the timeline yet. We do a weekly, right now they're doing a check-in with the state health department, our 1 o'clock meeting, so they may have more information about that today, but I don't know the answer to that.
Okay, well, one of the things you mentioned in here was, I imagine that the plan is for at some time in the future for public health not to be the primary vaccinator for the public.
Correct. We will have multiple options. Yes, people will have many options.
Right. And I think that's probably where you get our most vaccines out there. But how in the world, based upon what's happening with the state and their allocations, how do we increase the number? I know you said you can't ask for them, but if they're only allowing us to give so many, then increase that. Even if we have more people and getting more volunteers and more people sticking needles in people's arms, if our allotment is still only 300 or 400 or 500, whatever it is, based on that number, if the health department is the only person that's able to do this, it'll take a very long time to vaccinate the 75 and older population.
So the health department and the hospital right now are responsible for doing the 75 and anybody else that we missed in. So our goal at the health department is we get in, for example, last week, we get in 975 doses. we all want to do our best to make sure that we hit that each week, so that we're starting each week over with the number of doses. So what I anticipate is more people enroll, and as the federal supply increases, then we will have more people vaccinated quickly at additional sites around the county. They can do that in collaboration with us at the hospital. But we can't, unless another hospital or health department gave us some of their vaccine, we can't get any more. Yes, point taken.
So this is not a situation where the more you give vaccines, the more you are given by the state?
Not necessarily. I think they're trying to make that a part of the formula, but we can't, so if you have, that has not been a part of the formula thus far. They are taking into account your storage capacity. So when we filled out our initial provider agreement, and we said we could store 6,000 doses, they're taking that into account, but they have a formula, and they still have to divide it by 100 health departments and by more than 100 hospitals across the state.
Real quick, I just got, you mentioned the active duty side.
Yes.
Obviously, we have 330,000 people, many of which are active duty or retirees. And, but we don't know how many Fort Bragg is going to actually be responsible for this.
So they are vaccinating their active duty soldiers. So that does not mean if you are, I'm trying to think if you have 75-year-old active duty soldier. But if you have a soldier, we wouldn't turn them, let me say that, we wouldn't turn them away at our vaccine,
Right.
if they were eligible. But yes, they are vaccinating their own individuals. The same with the VA and the same with CVS and Walgreens. They are also part of our denominator, our population size, but they are also vaccinating within this other pocket of the population.
So can veterans go to the VA?
Yeah. Starting today.
They get vaccinated right now?
I think they started today
Yeah,
or
today.
yesterday.
Okay, I didn't do that. It's good information.
Yeah.
There's a lot of veterans here.
Yes, but we will
Take it
also,
officially.
vaccinate them as well. So I ran the registration line with our team this morning. We had a number of veterans come through. So for some people, there are multiple options for where you can go and get vaccinated. You may be eligible at Fort Bragg and the VA, or of course at the hospital or the health department.
They have to be 75 or older if they go to the VA.
I don't have to verify that, but they have to also, everybody has to follow the thing.
All right, last question,
Yeah.
promise. Federal State University, FTCC, both have amazing nursing programs. Can they apply to be providers and actually open their own clinic?
Yes, they can provide to be, they,
Well, that was,
if they have storage.
yeah, that was gonna be my question.
Yeah, well, even the hospital store for us, right?
Yes, the hospital is storing our Pfizer because we don't have an ultra cold freezer. But they could enroll as a provider and the state approves them as a provider. They have,
So they can operate independently as a vaccine clinic on the campus of Federal State University or at FTCC.
correct. And so the way that they could do both. So they could have their own, if they have their own provider agreement with their own supply of vaccines, or they do what they're doing with us now is because they're already included in our medical malpractice insurance, and we already have an agreement with them outside of COVID to take their students, they vaccinate alongside of us as long as we have, or they have somebody on site that can help supervise.
Well, thank you, Dr. Rick. There's a lot of confidence in you doing an amazing job.
And I have one more piece of that. So one thing we can't do right now is, because they're not enrolled providers, give them vaccines without us. But they can vaccinate with us right now, which is
Commissioner Adams.
I just got one question, because I think Commissioner Council was hit what I said. As you get these doses, do they let you know how many Moderna and how many Pfizer? Because the Moderna doesn't have to be capped at that temperature, from my understanding. So do you get to say which one you want more of, or they just send you whatever they send you?
we get what we get. So the first week we got Moderna.
Right.
The second since after the first week, we only got Pfizer, and that's because CVS and Walgreens, as they were looking for Washington facilities, they needed the Moderna because they didn't have storage capacity. So they said, I'm making up these numbers, but the state health department, for North Carolina is getting 100 doses. We're taking this section off top and giving it all the Moderna. Therefore, local health departments, you're left with Pfizer.
So I guess that gets me to a transportation issue to these providers who sign up. If we get Pfizer, how do we get it from the hospital over to these people? I mean, it just tax you with some more stuff. I just don't know how you all,
Usually we call Chris Hart with the hospital the day before, and he helps us to make sure we're very close, so we can go get it.
But I'm just saying, these providers that David and Goshen and all of them, that gets to be another issue in terms of if it's the Pfizer, getting it from the hospital to, I think that.
When you start finding your provider agreements, you have to upload pictures of your refrigerator that you have, and you tell them, I have this capacity or this capacity. So if a provider said, I don't have ultra cold storage, then they won't give them Pfizer unless you have a way to store it somewhere. So they have, and then we get in our weekly allocation how many Moderna. Usually it's only Moderna or Pfizer. Usually we don't get both. Not yet.
Right. So that's what I'm saying. So if you don't get any Moderna and they don't have any storage space for the Pfizer, they're not going to be able to give it out. Even though they may be a provider, they just won't be able to do it until the Moderna comes, I guess. That was just, I'm fine. I mean, it's just, I'm a little crazy, man.
Really, but the state health department should only allocate what you can.
Yeah. Thank you.
Any more questions? Thank you, Dr. Green.
Thank you for your time this afternoon.
Madam Manager.
Yes, sir. Mr. Chairman, that moves us into consideration of agenda item. Item 4A is your consideration of an RFP for consulting services to address homelessness in Cumberland County. And I asked our deputy manager, Dwight Culver, to present this item.
Good afternoon, Mr. Holder.
Good afternoon, Mr. Chairman, and to all of the commissioners. Good afternoon. This first item for your consideration comes at the request of our chairman. And as you know, homelessness continues to be a challenge for many of our citizens, and consequently also creates a negative impact on several of our county services. The chairman identified this problem as a priority area. And since his appointment, he has met with staff, he's met with other members of this board, as well as city of federal officials, and in an attempt to better define and determine and assess the status of homeless services in our community, to include the city's plans for a resource center. As a result of that fact-finding mission, staff is in agreement with his recommendation that the most prudent next step in this effort is to engage the services of a subject matter expert to inform our planning and interventions for homeless services. We're seeking your support for the issuance of an RFP for homeless consulting services. The objectives of that engagement have been included in your memorandum that was sent out to you for this meeting. And they're also further articulated in the RFP. As you look at section 4.0 of the RFP, which is on page 6 of 29 of that document, it's entitled Scope of Work and Vendors Proposal Content Requirements. Your community development department would be the administering county department, and funds are available in that department's budget to fund the contract. Given the scope of this project, we estimate that the contract could range to as much as $30,000. If the board agrees, we would request a motion that this item be added to your consent agenda at your January 19th meeting. And if approved, we would propose a release date of the RFP for January 19th. We would expect responses back no later than February 19th. We would perform proposal evaluation during that last week of that month with the expected selection of a qualified consultant in March and the commencement of their work in March. There are 3 phases laid out in the RFP, and we would expect those phases to occur between the months of April and June.
Thank you, Ms. Toler. Are there any questions and discussion?
I have one question. Dwayne, thanks for bringing this up. You know, when the city did their homeless project, they really did bring us into the fold on it. And there's still some question about what their center wants to do. Is there going to be any conversation with this consultant as part of the city, or is the city involved in this one? Are we operating?
So we would be operating independent from an administration standpoint, but we will definitely be collaborating with the city. Our community development departments between the city and the county work very closely. And a lot of the data and information that we already have gathered is city and county information and data. And so we would expect to be sharing information as a thing. And make it a true countywide assessment.
Chair, I'd like to make a motion to approve $30,000 for a consultant on the homeless project.
Thank you.
Move it to the
Let me make a motion to move it to the consent agenda.
Is there a second?
Second.
All in favor?
Wait, you're Commissioner Mike.
4.
Aye.
Commissioner Evans, Adams, Mrs. Stewart.
I think before she left, Commissioner Council said aye too, before she walked out the door.
Madam Manager?
Yes, sir. The next item is 4B. It's consideration of a joint resolution of the Board of Commissioners and the City Council requesting Cumberland County's delegates to the General Assembly to sponsor a local bill to amend Section Law 1991-413, authorizing a prepared food and beverage tax, and also to modify the distribution of proceeds from the sale of alcoholic beverages in Cumberland County pursuant to GS 1AB 805E. So, Mr. Chairman and Commissioners, just a little bit of background on this item.
I mean, the chairman sent us a whole thing, unless somebody has some questions. I mean, if anybody has any
I
questions.
did one thing. What conversation about the structure of the TDA board that the city had mentioned? It's not in this at all.
That's correct. Now, one of the next items on the agenda, it's actually the next item, is Sally will walk through the state legislative agenda items.
During our discussion with the city, the city said, we don't have any problems if you want to include that. And so I'm just putting it out.
The only question I have, Mr. Chairman, is that this is so important to us. Do we start getting into another battle, bringing in some other folks? So I think in my estimation, I thought what the chairman did, keeping it clean, straight to the point that we need, made sense, and that's why I was.
I'm okay with it. I want to make sure what this story.
Well, we start bringing in that restaurant lodging group, and then you got people all over the state that want to talk about it. I think this just keeps it clean, right? What we need to do out at the Crown and the Coliseum to be able to do what we need to do. But
You make a motion.
Okay, are we ready
I
to
made the motion.
second? Is there a second? All in favor?
Your vote, Commissioner Langford?
Aye.
Commissioner Keith?
Aye.
Chairman Evans,
Aye.
Commissioner Stewart. Unanimous.
Thank you, board.
That brings us to item 4C, the 2021 state legislative agenda item. Ms. Shutt will walk us through that item.
How you doing, Ms. Shutt?
Good afternoon, everyone. The Board of Commissioners has invited the delegation to the General Assembly to meet on January 21st. And the survey was conducted of commissioners. And so what I'm presenting are the goals that were submitted by the Board of Commissioners to be included in the state legislative agenda. The number one goal is water quality, and that's seeking legislation to improve water quality in Carolina, but especially in Cumberland County, and to address and seek state participation in the Gray Street Water Project, requesting funding and support for extending water lines in the contaminated field. Goal number 2 deals with the food and beverage tax, which we just passed that joint resolution. Food and beverage tax, the division and include a resolution to distribute a portion of ABC funds to the city of Fayetteville and other municipalities. The local occupancy tax, based on the discussion that's just taken place, how would you like to address this? Do you want to continue to pursue that? This is to amend the local occupancy tax legislation to allow Cumberland County to change the makeup of the Tourism Development Board to allow the county to operate under House Finance Committee guidelines for local occupancy tax and board membership.
Do we know what House guidelines are for board membership?
We are the only state that has a provision, the only county, I'm sorry, that has a provision for the distribution to the Parks Council and things like that.
But
We've
the more-
had this on the agenda before.
Yeah.
In the past, we have.
we're talking now primarily though about the board makeup of the PDA. And the board makeup of the PDA, I know in some other tourism development authorities throughout the state, they have certain makeup of it. They may have some people from the entertainment industry, or then they might have some people from the live industry. I don't know. But ours is very, very tight, exclusive. And that was the goal, was just to allow the PDA board to be more inclusive instead of exclusive, but still involved in the tourism aspect of it. Mr. Chairman, the reason I bring this up, this is a $3 million budget that they receive every year. And the Tourism Development Board has been basically the same, less than 10 people for the last 20 years. They just been rotating because of the wording of the legislation. So all I care about on this right now is to be able to, the TDA board, that the commissioners have a little bit more leeway in accordance with House Finance Committee guidelines, what other counties do. So that was the first. I've gotten off the Orange Council and all that other stuff.
So that would be part of the discussion we have with legislators, or that you will bring up with the legislators, sir.
On the makeup of the board.
Okay, yes.
In accordance with House guidelines.
Infrastructure, goal 3, include legislation to expand infrastructure and broadband capability to unserved residents of Cumberland County. And I know there will be an announcement made today at 3:30 from the Corporation regarding broadband.
Will that give broadband capability to the rural areas? I know that's what the idea is, but will it?
I tell you that the stuff that I got from Robert Van Gien's doesn't say complete unincorporated areas of Cumberland County. They'll talk about all the municipalities and a great portion of the unincorporated areas. So I don't know that all of it's going to get, because that's the way it comes across. So it doesn't say.
Should we keep it on?
Yeah, I mean, you know.
I think long and it's very important. Yeah, everybody gets it.
School funding to support legislation to repeal the statutory authority that allows school boards to sue for the commission over appropriations and to increase funding, lottery funding, or additional revenue to expedite address public school capital projects. And then the fifth goal.
We all should be happy about.
The fifth goal deals with grants and other opportunities to identify and explore grant opportunities from the state, to identify and explore economic development and broadband services opportunities for counties designated as Tier 1. We are a Tier 1 county and look for those opportunities. Goal 6 is a goal that it's almost every year we bring forward, is to oppose any unfunded mandates and shifts of state responsibilities to counties. These were the goals that we received through the survey from feedback from the commissioners. In your packet, we included some information that we sent on to the North Carolina Association of County Commissioners statewide goals that were submitted by department heads. So I want to find out if there are additional goals that the Board of Commissioners wish to include for your consideration today as we prepare this agenda for the meeting on the 21st.
Are there any questions?
Sally, I had asked a question that so many times when we have these meetings, we only get an hour and half of them leave before it's over. But one of the things I would like to know from the legislative delegation, we've never done this, but historically they came and ate breakfast, but nobody's really pushed any of our agenda items. I'm curious from the state representatives what their goals are in the next legislative session and what they plan on sponsoring at moving forward too, so we can know what, if there's any opportunities for us also as they lead forward. You understand what I'm asking? You know, I don't know what House Member Soka or Senator Debbie Ayers, Senator Clark, I don't know what their passion is and how it affects Cumberland County and how it's helping Cumberland County. So I'd like to know personally from them what their goals are for the next session.
So, Commissioner Keith, normally on the agenda, we have an area for the delegation to provide comments. And one of the things that Representative Richardson, who is now the chairman of the delegation, he has asked that Dr. Green come and speak briefly about what the needs are for Cumberland County regarding COVID. And also, that would be the opportunity to do a roundtable for them. We would need to limit the time and make it clear that they would go, you know, and for that. We do have a time on the agenda every time we meet for them to speak. Did you want that information ahead of time, or to have them be prepared to speak?
I would like it ahead of time, but I don't think I'll be receiving it ahead of time.
Yes, sir.
You know, and I was at a meeting last week with the delegation. Representative Soka again said the same thing he always says, and so if Dr. Green comes in from the health department, because I asked him, I said all health departments need some more money, and he says, give me an amount, give me something, tell me what it is. These are broad. I mean, we got such broad things. His thing is going to come back is, what do you want? How much dollars do you want? Ask me a dollar amount, and I will tell you, you know, I'll go with that. You may not get that amount, you might get less. But these are such, I mean, what we've got is just, you know, they're so broad. That's the question he's gonna put at the end of the day. These are some broad things and you ain't told me what you want.
Yes, sir, and so as we prepare the agenda packet for them, that background of information that we give them, we will have it in more detail with the bill, the resolution that you just put forward, that will be approved.
No, I'm talking about even on the health department.
Yes,
If she
sir.
needs, $5 million, she needs to ask for $5 million.
Okay,
Yeah.
we will have specific, request in there to ask.
But we don't know that. I mean, we don't know what that,
And I will have that.
that's what we should have been having today, I think. And so we could have had some input on that is, you know, those kind of things. I mean, we get these every time on the broad things, but I think we should have had some input as what we want and what, you know, if it's the health department, I love the fact she gave us all of that. But what does she need? You know, we were just talking about transportation. We were just talking about all of these other things. If it's on broadband, how much money do we need to expand broadband? Those are the things that I think that one of the reasons I don't think we get anything from the delegation, we ask for some broad things. Oppose unfunded mandates and shift the state. They'll say, yeah, we do that. We agree with that. When they talk about this thing with the school system, is be specific. We just got to be specific on some things, and that's what. Not that I don't trust staff like staff, but I think that's what we're supposed to do is to help you get those numbers or whatever that is.
It's a good point. Because water is a big thing too. We're not asking for a number.
What's the number? We need to ask for a number on water. Yeah, we all want water in this community. Do we need $5 million? Do we need $2 million? What is it that we need? Because, you know, they're going to say we support water and they gave money to NC State to do the fluorides and stuff, but that didn't help us in terms of what we needed. If we're going to build out this system or whatever we do, how much money do we need from the state? State ain't giving any. You ask for it, you don't ask for it, you don't get it. That's what I tell the judges that all the time when they ask me that I was asking for the world. So even if we talk about water, $2 million, $5 million, he's going to ask. I'm just going to tell you what Representative Soka's going to say is, how much, you ain't told me how much you want. I can't put it in a bid.
Are there any more questions, discussion? Your motion?
Motion to approve the goals for the legislative record.
Second? All in favor?
You vote Commissioner Lancaster,
Yay.
Commissioner Reed,
Aye.
Chairman Evans,
Aye.
Commissioner Adams.
Aye.
Commissioner Stewart.
Aye.
Unanimous.
Will we get those numbers beforehand, though?
Yes, sir, so this will be moving forward to their, consent agenda on the, so as we will create the booklet and everything for that, I will provide it to you and the
Before the
delegation.
book.
Yes, sir.
I mean, the amount.
For your review.
Yeah.
And then, they have asked to receive it before, so they have time to read it and be prepared for the meeting.
Item 4D is a request to add to the chairman's commissioner liaison appointments. As you may recall, in November of 2019, the Board of Commissioners approved the process that is that the incoming chairman would make commissioner liaison appointments only to those boards or committees that required representation by a member of the board. And those committees are listed in your packet. Chairman Evans believes that to our advantage to add back liaisons to the Federal Cumberland County Parks and Recreation Advisory Board, the Public Works Commission, and the Civic Center Commission, all three as commissioner liaison appointments.
And the reason that I brought this up, brought this to you is because we're now dealing with the Performing Arts Center. I think that we need somebody there to, at those meetings, as a representative from the Board of Commissioners, since we're highly involved, as well as with PWC, we need a representative there because we're talking about the water, improving the water out in the Grace Creek area and hopefully throughout the county. And Parks and Rec, I think that we need to have someone there. And that's why I brought that back to you, brought that to you. Any discussions?
Mr. Chairman, I think you need one to the ABC board too, with the amount of money that they give, what they're buying and what they're doing.
Any more discussion? With that, you want to add that, sir? ABC board? With that, ABC board.
But that, and Mr. Chairman, I guess at the end of the day, is where we're gonna go. I mean, that's the whole thing of if you get appointed, are you gonna go? I mean, that's.
Well, and you got a point. And on the one individuals, I'm sure that we will, since we have a vested interest, if we have an interest in these items that's important to us, such as the water, such as the crowd coliseum. And I believe that we'll be there. We definitely got to be there. That's what we're talking about, giving up money for ABC. So I believe I would pray that everyone will go.
Mr. Chairman, if that's your desire, I'd like to make a motion to put onto the consent agenda the addition of those 4 liaisons.
Is there a second?
Second. I'm sorry, but I second it
Thank you.
anyway.
All in favor?
Your vote, Mr. McCaskey?
No.
Commissioner Council?
Makes me think I better wait and see exactly what it was. I think I want to second it. If I change my mind, I'm gonna say no.
Aye.
Commissioner Adams? Is 5-1.
Thank you.
Mr. Chairman, the
Yes.
next item 4E, is consideration or for information and for the record, a legal opinion for an exception to the conflict of interest rule in the plan rental rehabilitation program. Ms. D. Taylor, Community Development Director, is attending virtually to reduce the number of staff members we have in the room for social distancing purposes. Ms. Taylor, can you hear us?
Yes, ma'am, I can. And I hope, good afternoon, commissioners. I hope you can hear me.
Welcome, Ms. Taylor.
Okay. So the item you have before you is just a matter for public disclosure. In November, Ms. Siobhan McLam, who is an employee of Community Development Department, submitted a rental application to Kingdom Community Development Corporation to rent a unit that is owned by the organization. Kingdom did review her application and determined that she was eligible to rent the unit. And since Kingdom is a loan and grant recipient of community development, we're required to obtain a legal opinion from our attorney to ensure that state and local laws are not violated and to ensure that we make this matter for public disclosure. And so as we've done several times in the past, once we've obtained a legal opinion and made the matter a public record, we will then submit a letter to HUD to request an exception to the conflict of interest provisions. Again, there is no action required of the board, but we just have to make this matter public for public disclosure. But I'll answer any questions that you may have.
Thank you, Ms. Taylor. Are there any questions or discussion?
You always got some discussion.
Yes.
This has nothing to do, I don't have a problem with
Yes,
it, because that is,
Adams.
the problem I have is that an employee of ours who works 40 hours a week falls within this category, which means that we need to raise our wages for the county. And I know Madam Manager, I know we're in the process of doing that. It is a big process. We have to do it. This is like the 3rd year. I think we're in the middle of this, but when we're looking at somebody who works 40 hours a week, there's just, I think we can't sit and as everybody's talking about wages and stuff, I just find this kind of disturbing a little bit in terms of that. And I know the manager, we've talked about this and the chairman and I have talked about this. And I do appreciate management moving and doing the things we're doing with HR and stuff. Probably taking longer than I want. Mr. Holden and I had a discussion on that yesterday. So this has nothing to do with, I think she's fine to be able to do that, but I hope that we don't have to continue to do this with our employees, to be able to do that, and we will get them to wages, to be able to, I think that's one of the things in Cumberland County is people having to work a 40-hour-a-week job and then having to work another job just to meet their basic needs. You have to be able to meet your basic needs on your first job, and if you want to do something better on your second, get the second job, then that have to be that. But we need to be leaders. We can't go out and tell the community to do wages if we don't do wages in terms of that. And, you know, when you got employees, even in the military, when we've got privates who getting services from DSS, that's just deplorable to me, who put their life on the line and that they don't get enough wages to be able to take care of them. That's just wrong. And I think we need to make sure that in this community, we know that we're addressing that problem. I think that our citizens know that we're in the process of addressing that. And I think that that's where we got to continue. Thank you, Mr. Chairman.
Thank you, Mr. Vice Chair. Is there any other discussions? Thank you, Ms. Taylor.
All right, thank you.
Information. Madam Manager.
Yes, sir. Item 4F is consideration of award of bid at the Ann Street landfill for the scale house project. We have our solid waste director, Ms. Amanda Botto, here.
Welcome, Miss Amanda Barr.
Thank you. Good afternoon, to the board. We are excited to bring to you the scale house or the scale house project for Ann Street. This project will add an additional outbound scale for Ann Street. There will be, in terms of inbound scale, there will be one cash customer sale and an account holder scale. That with the additional outbound scale. The project was bid on October 1st, 2020. The low bidder was rejected because their bid schedule was not complete. They did not complete the unit prices for all items. Legal has concurred with the engineer's determination. After that bid was rejected, we began negotiations with the second low bidder to bring a contract amount under $1 million, which is allowed under North Carolina General Statute. $1 million was the amount we had budgeted for the construction of this project. We asked that the award of this contract be placed on the consent agenda for January 19th. We are also asking for authorization for the county manager to sign change orders as recommended by the solid waste director. Are there any questions?
Are those change orders making over $1 million? I mean, that's.
Well, what we were looking at, good question.
We get back to where we were that we needed to bid it if those change orders get above.
We were awarded a grant by the North Carolina Department of Environmental Policy for a concrete pad for single recycling. I had put that project out for bid 2 times. And my thought was that we would at some point look to this contractor who will be on site to price this for us. And we would use the funds that were allocated for that project to pay for that. That's what I have in mind.
So, Mr. Chairman and Commissioners, if I am ever given the, that's not Sally. Thank you, Sally. If the board on any project gives me the authority to change, to sign change orders, they have to be within that contingency amount, and I can't exceed the total bid amount, which is the bid amount plus the contingency.
So what do we need to do, Madam Manager, in regards to that?
So we're asking the board to approve the bid that includes a 5% contingency. We do that on any project. Amanda is also asking for expediency purposes that if there is a change order, that I have the authority to sign it within the amount that you allot for contingency. over the course of most of our projects, we have very few change orders. In some instances, we actually add money back to the project.
Okay, are there any questions, discussion?
So,
Well, but I just need to know the amount. That's what I mean, because she bid it out and then she was talking about not being able to do that because it was gonna be less. I mean, that's, I'm just kind of.
the bid report is actually for $975,000 of the total.
Okay.
It's 985,022, that includes a 5%. Yeah, $985,022. That includes a 5% contingency for any potential change orders.
Which may include that profit. I move that we follow the recommendation.
Second, is there a second?
Second.
Not our second.
I said, I go out to the landfill quite frequently, so I'll second it. I need that scale. Yes.
Commissioner Thompson?
Yes. Just say yes.
Yes.
Commissioner
Aye,
Lee?
aye.
Commissioner?
Yes.
Chairman Evans?
Yes.
Adams?
Yes.
Unanimous.
You said, you made.
Thank you. County Manager, item G.
Yes, sir. Item G is a consideration of construction contract with Engineer Construction Company. This is for 500 Executive Place. Assistant Manager Tracy Jackson is also doing this virtually and will present this item.
Good afternoon, Manager Jackson.
Good afternoon. Can you hear me?
We're ready to approve. We're very well versed on the contract.
And I really got the second.
All in favor? Is there a motion?
Motion to approve.
Motion. Is there a second?
The committee looked at it, and so we.
All in favor?
Your vote, Commissioner Lancaster?
Yes.
Commissioner Council?
Yes.
Commissioner
Aye.
Lee? Chairman
Aye.
Evans? Commissioner Adams?
Yes.
Commissioner Stewart? That's unanimous.
Thank you, Commissioner. We're looking forward to get that project going very quickly. Associated with this item is item 4H, and our Finance Director, Vicki Evans, is coming forward. This is consideration of limited obligation bonds, better known as LOBs, Series 2021. This is the final approving resolution and budget ordinance amendment 210076 and 210088 for your consideration.
Welcome, Ms. Evans.
Thank you. Good afternoon, Commissioners.
Yeah.
So, finance staff have continued to work with our underwriter bond counsel and our financial advisors on the documentation requirements of the upcoming debt issuance for the EOC capital project and the FTCC Fire Training Center. The next step is board approval of the final approving resolution, which was attached to the agenda. In summary, that resolution gives authority, will give authority upon your approval to, for county staff to be able to execute the necessary documents related to the debt issuance. Okay, so in addition to the, that resolution, we need you to consider budget ordinance revision.
So move, Mr. Chairman.
Second.
All in favor?
Commissioner Whitehouse?
Yes.
Commissioner Thompson? Yes.
Aye.
Commissioner Stingy?
Aye.
Chairman Evans? Commissioner Adams?
Yes.
And Commissioner Stewart?
Aye.
Unanimous, thank you.
Can I say something real quick? Thanks to Glenn and the other members and Tracy and you. When we initially started talking about 911 and the EOC Center, that number was $24+ million. Right now, we're budgeting, we're gonna make this budget of $16 million. We just saved Cumberland County residents $8 million by good work. Commissioner Adams was the chair of that group. Thank you.
Well, you were on there. Thank you. You and Commissioner Booth.
Who seconded that one?
Thank you.
All right, Madam Manager, item I.
Yes, sir. Thank you, Mr. Chairman. This is consideration of a revision and amendment to the Cumberland County zoning ordinance in its entirety for the purpose of bringing the ordinance into compliance with the newly adopted Chapter 160D state statutes and updating the table of contents. And our Planning and Inspections Director, Mr. Ross Howard, will present this item.
You're welcome, Mr. Howard.
Thank you, Commissioners. So, as Ms. Kennedy just noted, this is a comprehensive update to the county's zoning ordinance to bring in conformance with the newly, the comprehensive update of state statutes that govern all the land use laws throughout the state. In your packet, I tried to keep this as short and as efficient as I possibly could. So in the packet, instead of putting in the whole 200-page zoning ordinance, we only cut out those pages with a strike through and underline for the pages that would be applicable to this update. This comprehensive update across the state of North Carolina was the collective effort amongst many, many different associations, including the Bar Association, Planners Association, League Municipalities, County Commissioners Association, a number of development interests, to basically bring our standards up to a more modern and efficient and easily interpretable type of format. So just a little bit of background on this. I just want to point out that this is a state mandated update. So the states update their codes. They told the cities and the counties across the land, you have to update your ordinances in accordance. So essentially what this does, for those of you that don't know state statutes, the county statutes fall under what they call 153A. The city statutes fall under 160A. So what they've done is essentially melded those two into one new chapter that covers both cities and counties underneath the same standard, which is now 160D. So again, this is the first comprehensive statewide update in decades that the General Assembly has approved in 2019.
Can I ask one?
Yes.
I looked through the whole thing, I don't have a problem. But Ross, on page 51, under the section that deals with conditional zoning, and you might be able to answer this one, they went from public hearings to legislative hearings. Does that mean we don't have to notice people? I mean, it just seems that this doesn't seem fair, and I know you didn't do this, came from the state, but it doesn't tell me what a legislative hearing is. So do they still, and under the amendments, they have to be a notice. But up under this section, it just changes it from a public hearing to a legislative hearing, but it doesn't talk about noticing anybody. On a public hearing, you got to notice people.
Right, and I think Raymond actually had a conversation about this just before this meeting. I mean, like, to me, it would be a semantical conversation to just public versus legislative. I think we would still go out and we would do what we've always been doing underneath a public hearing format. But I mean, we're kind of, if there's anything you want to add about the difference.
We're still required to give the same type of notice as the old law. The only real change in it is now you don't actually conduct what we have called public hearings, called legislative hearings. And the public is invited to make a written comment, which is for us to get 2 days before they consider it. That's the law. That's it.
So it just requires us more work to be, they don't get to talk, they just sit in, they don't.
Yeah.
See, I didn't put that part in there. I know, it's by the state, I mean, I understand. I'm fine. That was just I didn't know what it was.
I reviewed all this stuff.
Yeah, I just didn't know the legislative thing, they went from public hearing. So I'll make a motion to approve this item, Mr. Chairman.
Is there a second?
Yes.
All in favor?
Commissioner Lancaster.
Yes.
Commissioner Council. Commissioner Keith. Chairman Evans.
Yes.
Commissioner Adams.
Yes.
And Commissioner Stewart. Yes. Unanimously.
Thank you.
Thank you, Commissioner.
Thank you, sir. Madam Manager, item J.
Yes, sir. Item J is another bid report. This is for building enclosure repairs, and Mr. Jackson is still with us, and he's going to present this item.
Okay, the engineering department recently received a bid for building enclosure repairs. And as it's delineated there in your memo, this is for 3 separate buildings. the building maintenance facility, recoating the metal roof there, for the library, closing in wood trims and the windows, replacing the window in West Regional Library, adding water repellent in various places. As I said, only one bid was received. Fleming & Associates recommends awarding the project to M&E Contracting in the amount of $143,284. This bid is under budget and funding is available to proceed with this work. We recommend approval and moving it on to the January 19th Board of Commissioners meeting. We're asking for approval of the building enclosure repairs bid tab to include the base bid and alternate 1 and 2 for a total of $143,284 and award the project to the lowest, most responsible and responsive bidder, M&E Contracting Incorporated.
Any discussion or questions?
Questions?
Any discussion or questions?
So move, Mr. Chairman.
Yes, Mr. Lancaster has.
Oh, I'm sorry.
So I just said motion.
Okay, yeah.
Second? All in favor?
Your vote, Commissioner Lancaster,
Yes.
Commissioner Council, Commissioner Keith.
Aye.
Chairman Evans,
Yeah.
Commissioner Adams,
Yes.
and Commissioner Stewart.
The soil and water, we can do that too. We don't even spend any
Madam
money.
K, Council Manager.
Yes, sir. Item K is the consideration of a contract or a master service agreement between the North Carolina Department of Agriculture and Consumer Services, the Division of Soil and Water, with Cumberland County, there's an associated budget for that.
I move that we move this to the consent agenda to the January commission. There's no county.
All in favor?
Your vote, Commissioner Lancaster.
Yes.
Commissioner Council, Commissioner Keith. Chairman Evans,
Yes.
Commissioner Adams.
Yes.
And Commissioner Stewart.
Yes.
Unanimous, thank you.
Madam Manager, item L.
Item L is another contract with the Soil and Water Division of North Carolina Department of Agriculture. This is under the Watershed Restoration Project. We're asking for approval of the contract as well as a budget ordinance amendment 096.
Questions? Any questions? Is there a motion?
Motion.
Second? Yes, Commissioner Booth. Is there a second? All in favor?
Yes.
Commissioner Lancaster, Commissioner Council,
Yes.
Commissioner Keith.
Aye.
Chairman Evans,
Yes.
Commissioner Adams,
Yes.
and Commissioner Stewart.
Yes.
Thank you, unanimous.
Madam Manager, item M.
Legal requirements for the appointment of members to the Tourism Development Authority.
That's it. Yeah, this is the one, this is the item that we were talking about doing the committee on, and I asked our vice chairman if he would lead that committee on this particular item, and he said he would now. Okay, so we're now on to item 5.
We have no other items at this meeting. Item number 6, we have included our regular monthly reports, and we are happy to answer any questions that you may have about any of those reports included.
Any questions?
Ready for the closed section.
You have a motion to go into closed session?
For an attorney-client matter pursuant to North Carolina General Statute 143-318-11A3.
Madam Manager, I apologize. I got ahead of myself there. Is there a motion?
I mean, yes.
All in favor?
Your vote, Commissioner Lancaster, Commissioner Council, Commissioner Keith. Chairman Evans,
Yes.
Commissioner Adams,
Yes.
and Commissioner Stewart.
Yes.
It's unanimous.